Hi, I'm Dr. Ismail. Can I examine your chest? Is that okay?
Yes.
All right, thank you very much. Just gonna have a look at you. Let's have a look at your hands. Turn the hands around, please. Okay, let's check your pulse. Can I feel your groin, please? Yeah?
Yes.
Any pain in your shoulder at all?
No, not at the moment.
Okay, thank you very much. Okay, look at your eyes. Look up for me, please. And look down, please. Open your mouth for me. Lift your tongue up for me, please. Thank you very much. Okay. Turn your head this way for me. Okay, I'm going to pull the sheet down a little bit.
Yeah.
You turn your head this way. Just going to press on your tummy. Okay. Just going to feel your chest. And have a listen to your heart. Let's have a look there. Can you turn to the left side a little bit more, please?
Yeah.
Okay, thank you very much. Okay, you can lie on your back now. Stop breathing for 1 second, please. Okay, thank you. Stop breathing again. Okay, thank you. Can you lean forward for me, please? Take a big breath in for me, please. And out. And hold your breath for me, please. Thank you very much. I'm just going to press on your back. Have a listen to your chest at the back. Breathe in for me, please. And out. And again. And out. You can lie back now, please. Have a look at your legs. Any pain in your legs at all?
No.
Okay, thank you very much for your help. Thank you.
Thank you.
Okay. On general examination of this patient, she was comfortable at rest, and on examination of the pulse, it was regular with normal volume. The pulse rate was 64 beats per minute regular, The JVP was not elevated. On examination of the pericardium, the apex plate was in normal place in the fifth intercostal space. There was no any palpable thrill or heave. On auscultation, there was a mid-systolic click followed by a late systolic murmur with no radiation to the axilla, and was no any other audible murmur at the aortic or pulmonary area, and there was no carotid bruit. The patient clinically was not in heart failure. There was no sacral edema. Chest bases were clear on auscultation, and there was no leg edema. On general examination of this patient, she was comfortable at rest, and on examination of the pulse, it was regular with normal volume. The pulse rate was 64 beats per minute regular. The JVP was not elevated. On examination of the pericardium, the apex plate was in normal place in the fifth intercostal space. There was no any palpable thrill or heave. On auscultation, there was a mid-systolic click followed by a late systolic murmur with no radiation to the axilla, and was no any other audible murmur at the aortic or pulmonary area, and there was no carotid bruit. The patient clinically was not in heart failure. There was no sacral edema. Chest bases were clear on auscultation, and there was no leg edema. This patient has got a diagnosis of mitral valve prolapse, and she was not in heart failure. That was evident by a mid-systolic click, which was best heard in the apex area, accompanied by a late systolic murmur with no radiation to the axillary area, and the patient was clinically not in heart failure. I would like to finish my examination by checking this patient's blood pressure and also checking the urine dipstick for any evidence of microscopic hematuria. Mitral valve prolapse is most likely to come in as a case for the cardiovascular station. The candidates are expected to know some detail about mitral valve prolapse, such as it is a condition which occurs in about 5 to 10% of the population and more common in female. And also you're expected to know that it is characterized by a mid-systolic click with a late systolic murmur. The examiners also might ask you how to investigate for mitral valve prolapse, and this is mainly in a way of doing an electrocardiogram to look for signs of, for example, atrial fibrillation or any other arrhythmias, and also an echocardiogram to see the degree of mitral valve prolapse and any accompanying mitral regurgitations.